Hello, good afternoon, everyone. I'm gonna wait just a couple minutes to let others join, and then we'll go ahead and get started. You're welcome to keep your cameras off, no problem. If you could also mute yourselves, that would be great. And then, like I said, we'll just take another minute here to get started.
Am I here?
All right, well, it's a couple minutes after 2:30, so I'm just going to go ahead and kick us off. So hello and welcome to our June SparkMap webinar. My name is Jamie Kleinsorgi. I'm a senior project coordinator for CARES, and CARES is the organization behind SparkMap. CARES stands for the Center for Applied Research and Engagement Systems, and I like to tell folks that we had that name long before the CARES Act came about. So we have been around for this is our 30th year in existence, and so excited to have you all join us today for this specific webinar looking at some of the American Community Survey data that we just released on our site. It has been out from the census a little bit longer, but it took us some time to integrate it into our map room and to our reports. A couple of housekeeping items, like I mentioned, you're welcome to turn on or off your camera either way. Please make sure that you mute yourself though during the presentation. And if you do have questions, there is a chat feature. So my colleagues are on as well, and they're happy to answer questions in the chat. Also, if you want something demonstrated again, or you want to just make a comment at the end, we'll definitely have time for that as well. You probably got the little recording pop-up when you joined, and so we are recording this. You're welcome to or please accept the recording, and then we'll make sure that we include this on SparkMap so you can view it later or share it with others. So without further ado, we're going to go ahead and get started. So as I mentioned, today's focus is really going to be on the newest American Community Survey release. And so we do have a couple of just sort of housekeeping updates on the data side of things. And so wanted to start there just so you guys are aware of this as we're going through the presentation and as you're seeing some of these data represented. So first and foremost, we have implemented across all of our sites and SparkMap as well, an update to the 2020 census geographies. And so basically what that means is, you know, in 2010, when the census did the decennial census, they created a set of census tracts and place geographies and zip codes. That was based on population for 2010. Now that we have the 2020 census data, they have updated it. And so census tracts are based on the number of people sort of in a given area. So in urban areas, they're often really small, trying to capture around like that 10,000 person mark. And in rural areas, sometimes they can be really big because there's just not as much density there. So some of those have shifted because our populations have shifted. And so you will see those reflected throughout the site, like I said, both in the assessment and in the map room. So if you're curious, so first off, we have only updated census tracts and place geographies. They have not, but have alluded to updating zip code geographies, but the census hasn't released those yet. So this is really only pertaining to those two specific geographic levels. If you want to see what has changed in your area or in other areas, the best way to do that is going to be using the map room on SparkMap. you can search for what's called Tiger boundaries, and you would want to select last year and this year. And so you will be able to see as you toggle on and off or use the swipe tool that what census tracts have maybe grown or shrunk, depending on those population changes. So that does present us a little bit of, as we're thinking about how data are represented in the map room and in the assessments, just know that we have implemented the switch to the 2020 census geographies, and so it will be using as base those new census tracts and place geographies. Nothing has changed to counties, so if you're just using county level data, no considerations needed there. Finally, the last point that I wanted just to make sure you guys all knew, and maybe you've already seen, is that sometimes we know that you're in the middle of a reporting cycle and you have sort of a line in the sand, right? We need to only use data that are up to this certain point. And so because of that, and because we know that there's analysis considerations that it will be needed, we have made a version of the community health needs assessment using the 2015 to 2019 data sets. And so you can, at the very top of the assessment page, there's a little bit of text and a link, and we'll go live here in a little bit, and I can show you that, but just know you can sort of use an old version. So if you were relying on or previously using those 2015 to 2019 indicators, we are making a version of those still available within the community health needs assessment for a limited time. So get them while you can. Otherwise, the 2016 to 2020 indicators are now in just the standard report that's there. So those are a few of our updates just based on, like I said, Census 2020 and the new American Community Survey data. So now I'm going to jump into a couple of specific indicators. So wanted to highlight a couple of ways that you can use the ACS data, old and new, to really dig deeper into some issues. And so we'll spend a little bit of time on that. And then, like I said, I do want to demonstrate an update to our vulnerable populations footprint and show you some of these changes, and then we'll take questions at the end. So let me go to my next slide here. So just a little bit about the American Community Survey, if you're not familiar. The source is the U.S. Census Bureau. It is something that they produce annually. They do have one-year estimates, but what we're going to be really focused on today and talking about today are the 5-year estimates. And so when we think about that, we think, like I mentioned, there's 2015 to 2019, there's 2016 to 2020. And so those are really aggregates across those 5 years of surveying that the Census Bureau does. They do release these annually, and there was a bit of a late release this year because they had to take into consideration, obviously, the pandemic made things slow down, and some of their analysis needed to be checked and a little bit more rigorous. And so it took us a little bit longer because of that to also get it integrated into our report. So we appreciate your patience, but you should see it populated across, like I said, both the map room side of things and the assessment side of things. So the first indicator that I really wanted to dive into was housing. So housing is one of those things that if you read the news, I don't think that you can miss what is going on sort of in both like the purchase of houses around the country, but then also in terms of the cost of rent and just really the cost of housing in general. Some of the areas that are most talked about are the Oakland, San Francisco type of California areas. And so that's what I have showing here. And the layer that we're looking at that's available through the ACS is cost burden households, which means that their housing costs, an individual's housing costs, exceeds 30% of their household income. So that's really the threshold that's been set, is that folks that are paying more than 30% for housing are considered cost burdened, right? They're going to have a hard time paying for other types of utilities, foods, and other services because they're spending so much of their income, right, just to pay for housing. And so what you can see here is I do have a side-by-side comparison of our 2012 to 2016 layer. So we're looking at sort of historical, and then the new data for 2016 to 2020. Some of the things that you can note here that I noted as I was going through this are we can see that the Oakland area, so more of the area to the east, it hasn't really changed all that much. The Oakland area is still having a very hard time thinking about and making changes to policies and the actual cost of housing in the area. And that's due to a lot of factors. We'll talk a little bit about some of those factors, but really geographically represented, we can see that there really hasn't been much change. Alternatively, if we look at the San Francisco Bay Area, right, which is going to be more on the west side across the bay, we can see that in 2016 to 2020 data, we are seeing some of those census tracts that have lowered the number of cost burden households. And so I wanted to show this area just because, like I said, it seems like no matter what news you're reading about housing, the San Francisco, Oakland area is sort of always mentioned because housing costs are just so high there. So we have seen a little bit of change, though. Like I said, not much on the Oakland side, but definitely some reduction in costs on the San Francisco side. So hopefully it continues in that direction and they continue to see some of those housing cost reductions. Now we can dive a little bit deeper into this by using our assessment tools. And so one of the indicators that we make available is this average monthly rent. And so you can see here that I'm looking at Alameda County and San Francisco County. So that was kind of that area that I had showing there on the map. That we can see what rent costs, and by sort of these, different bands of rent costs. And so we can see that there's not very many that we can see here under $300. That's likely, just due to the market. But as we look at both the report location and we look at those individual counties, what we can see is that really the problem is that the majority of the housing that's available for rentals falls into these two highest cost categories. And so we can see here that, in the report area, 131,000, about 132,000 rentals are available at that second highest price range. So the 1,250 to 1,500. And then we have even more, 170,000, almost 171,000 available at that $1,500 and over. And so as you're thinking about, different types of strategies, maybe housing is something that you work on or that you're thinking about working on, you have partners that work on, this is a really helpful table because ideally, right, you would want to have a nice stratification across all of these categories, right? You would have a good chunk that fall under that midpoint, right? The 750 and under. And then you would also have obviously some that are over that midpoint as well. And so as we're looking at this, I like that our reports, we can break them down. We can look at the aggregate report area, but then we can also look at those counties individually. And we can see here, that Alameda County, right, that's really where there's a bigger problem in terms of that affordability and the output or the distribution, of the average monthly rent and rental properties that are available. And so you can see here, like I said, again, we've got almost 84,000 in that higher category. and almost 110,000 in that 1,500 and over category. And so as you're thinking about strategies, funding investments, I would, and the data would recommend that you spend a little bit more time and energy focusing on potentially the Alameda County and a little bit less time maybe on that San Francisco. And we did see, right, some changes, right? Some of those shifts in San Francisco area that we didn't see over on the Oakland side. So this is just kind of one way to look at the map, look in that cost burden households, and then dive a little bit deeper with the average monthly rent. Here, I wanted to pick also another area. So we're looking at sort of the Minneapolis-St. Paul area. And you can see here again, there hasn't been a ton of change necessarily between the 2012 to 2016 data to 2016 to 2020, but we're still looking at that housing cost exceeding 30%. We can see that there is on the left side here, there is this dark blue sort of tract that goes all the way through, follows the river a little bit in that historical data. And then we see some more variation in the new data, in the 2016 to 2020 data. So there have been census tracts in the St. Paul, Minneapolis area that, that have changed, that have either somehow improved, some of the housing cost conditions in that area. And so again, just kind of diving deeper into some of this, you can see here that, again, the two counties in that area are Hennepin and Ramsey. We can see how those compare then to the rest of Minnesota and to the rest of the United States. The stratification here is a little bit better, in terms of what's available in some of those lower cost ranges, but we still see significantly more rentals available in those highest cost categories than in the midpoint or some of those lower ranges. Just an example there. So it was interesting to dive into the Minneapolis-St. Paul example because they have recently had a voter approved policy where they approved by the people of the area to cap annual rent increases to 3%. This is not indexed to inflation. They just decided 3% was going to be the cap. And there's obviously lots of community and economic developers that are very worried that this will disincentivize new developments coming to the area. Partially because the cost of building new housing, has gone up significantly, and they need to cover those costs. Also because, oftentimes 3% over a period of time is not enough to cover incremental improvements that need to be made, especially when it comes to multifamily housing and rentals that change over quite significantly. This is, again, kind of diving a little bit deeper. One of the other American Community Survey data sets that are available and that have been updated is vacant housing. So we can see here, again, looking at that Minneapolis-St. Paul area, how many total housing units there are, how many of those are vacant, and the percent vacant. And so this is a pretty low number, So there's not a lot available for people who are looking for housing, which is pretty much the state of the world in the United States anyway. And you can see here that that's true for both counties. They're in that low 4%, almost 5% range. And that's significantly lower than the rest of Minnesota and the rest of the United States. Now, we don't want a ton of vacant properties, but we do want to make sure that there are properties available for new people coming to the area, for people who may need to shift either up or down in terms of those rent categories and so on. And so this is another set, like I said, as you're looking at things like housing, cost burden households, what else can you look at? The vacant housing units is another way to just really dive deeper into that issue. So just a couple of notes, just so you know, some of the things that are going on in those areas that I highlighted. So in the Los Angeles, California area, they did recently pass some policies that talked about how hotels can be converted to permanent supportive housing. So that's one strategy that they're using to try to make more housing available, especially to, I think, low income renters. So that is something that's being explored and tested out there. In Minneapolis, in that Minneapolis-St. Paul area, they are changing zoning laws as well. So it'll be interesting to see how that 3% cap plays out. I think there's still a lot of talk about it there. So it'll be kind of interesting to see if it gets repealed or if the cap is indexed to inflation, like I said, or increased in any way. But they have also changed some of their zoning laws. And so that's another big part of the conversation is, what does the zoning look like? How restrictive is it? And how does it impact, right, the availability of housing? And so here we can see that they've changed some of their zoning laws to accommodate what they consider accessory units. So if you have a big house and you can turn part of it into an apartment, that is now being more allowed in that area to allow for more housing to be made available. So just kind of getting a little bit more creative with the properties that they currently have to make more room for folks. Finally, a lot of the conversation is around two suburban areas. So many of the zoning laws are very restrictive in suburban areas. So outside of bigger cities, in those, smaller communities that are feeder communities into cities, they often do not allow for multifamily housing. They often have large lot requirements, and so making those lot requirements smaller so there's more space for more properties is something that other folks are starting to consider as ways to address and think about really alleviating some of the housing issues that are going on around the country. So the next ACS layer that I wanted to dive into was uninsured children. So this is something that, again, relates to policy that we've seen at the federal level. So thinking about the Affordable Care Act and the timeline related to the Affordable Care Act. So it came around and started to be introduced in its policy form in 2011 and 2012. We didn't see a lot of action happening, in terms of what what was being offered in terms of new health insurance until 2013, 2014, 2015. And then we started to see a lot of policy changes to it after that. And so some of this is very apparent in the data, and especially when we're looking here at some of the recently available American Community Survey data. So here, this is Las Vegas, and we can see that, again, we're looking at track level data. This is uninsured population age 0 to 17. So what we would consider folks that are considered children, and it's our youngest population. And so in 2012 to 2016 data, we can see that, there are some of those darker brown areas where we see that uninsured populations are high, but it's not nearly as dark brown as we see now in this most recent release. It's much more concentrated. There's much larger blocks of census tracts that are now considered uninsured for children. And so I thought Las Vegas was a good example here, just because there has been such a stark change. And Nevada has been one of those states where the number of uninsured children has basically doubled. It went down by a lot because of the Affordable Care Act, and now it has gone back up. And so you can find quite a few sort of news articles referencing these shifts pretty significantly. So in addition to, looking at the children, the uninsured children, which, like I said, is a new ACS release, we can also look at the updated data for children in poverty. And so here we're looking at the children that are in the most severe poverty situations, population below 200% of the federal poverty line. So if you haven't noticed, in our map room and in our reports, we do have multiple levels of children in poverty. So 100%, which is going to be at the federal poverty line. We also have 200%, 185, which is typically important for anything to do with housing and urban development, and 50%. So all of those are available. Here we can see, though, poverty level below 200%, children, again, age 0 to 17% by track in the Las Vegas area. Again, lots of areas where we see that children in poverty is over 56%. And so we know those things are highly correlated. Children in poverty are often the ones that do not have insurance and that do not have access to quality health care. So there are definitely areas in and around the Las Vegas metropolitan area that would need some significant interventions in order to start to decrease the number of children both in poverty and experiencing uninsured status. As we dive in deeper to the uninsured population from the American Community Survey, one of the things that we can see is that we have data that are disaggregated by race and ethnicity. And so that even gives us a better idea of who are those children that are uninsured and in poverty in that area. So we can see here, Clark County, Nevada is where Las Vegas is located. We have non-Hispanic white, Black or African American, Native American, Asian, and these are the OMB categories for race. So we can see here that there's some significant differences between those children who are Black and white. The Native American population is also just really high in terms of uninsured rates. We also see significant increases in some other race. So those folks that may have, another race that they identify with. And then also the new category is also multiple race. So those folks who may have multiple racial identities, and that's how they identify. And so that does, again, give us a much better idea of if we were to focus some interventions, policies, programs in the Las Vegas area, what type of children should we be targeting? Which ones are most vulnerable to, this type of status? And we can see here, again, some other race, multiple races, and the Native American or Alaska Native populations have those significant populations that are uninsured. And those would be potentially areas or people to target in that sense. So we can also see this here. I wanted to focus on a rural area since Las Vegas is very urban. We can see here, this is Knoxville, Tennessee, and the surrounding area. Again, we're looking at uninsured population, age 0 to 17 by track level. The 2012 to 2016 data are on the left, and then the 2016 to 2020 data are on the right. And we can see some increases in some of those census tracts, right? Both in and around that Knoxville area, which would be considered a little bit more urban, but also in the rural areas surrounding it. And so this isn't just an urban issue, the uninsured children and children in poverty. It is something that is affecting both those urban areas and the rural areas of the country. So diving in a little bit more, these are data that are not from the ACS, but we do have additional data that are available through SAHI, so the small area, it's a small area health insurance estimate. And we can see here for Tennessee that basically what we saw is exactly what I described. So we've got the ACA sort of being introduced in this 2011 to 2012 timeframe. We start to see some reduction because of that policy and people being able to get more affordable health insurance from 2013 through 2016. There was a significant, leadership change in the federal government at that time, and some of those policies and protections for children and low-income families were taken out or demoted in some ways. And so you can see that now that has made an impact, and we can see that uninsured rates for children under the age of 18 are going back up in Tennessee, and you would see basically the same thing in Nevada, in that Las Vegas area as well. So just a couple of things to think about from the areas that we looked at and how they apply to the rest of the country as well. So we can see here that the number of uninsured children grew 16% between 2016 and 2019 in Las Vegas. So we definitely saw that represented in the map as well. There were a lot of areas where the rates were lower, and now we have large tracts where it's much higher. In Tennessee, it says here that children are 8 times more likely to have health insurance if their parent has it. And so Tennessee is one of those states that did not expand Medicaid. And so we're sort of seeing, right, the policy outcomes, implications of not doing that. Parents who would qualify for Medicaid, they would be able to go through that process, and their children would qualify for CHIP, the Children's Health Insurance Program. If the parent doesn't have health insurance, they're much less likely to get it for their kid. And if the parent has health insurance, they're probably saving money in certain ways, and they're able to redirect some of that additional money that they're saving from the health insurance to things like children's health care and children's health, right? And lifting other children out of poverty. So just some things to think about. And so, as I mentioned at the bottom here, really the Affordable Care Act is what we're seeing in the data, is a failure to expand Medicaid in some states. Now, Nevada did expand it. So what's going on there is just strictly their own sort of issues. There have been incremental cutbacks, like I said, to the Affordable Care Act. And then there's been just sort of a lot of bureaucracy around it too, which has discouraged folks from applying for and getting some of those health insurance benefits, whether through Medicaid, CHIP, or the ACA marketplace. So a couple of things there. The last one that I wanted to dive into, this is an indicator that I found very interesting, seniors living alone. And so because of the pandemic, obviously, we've heard a lot about people who are living alone, especially seniors and other, again, vulnerable populations. And so wanted to highlight that there are some new data from the ACS that show us, households with seniors age 65 and over that are living alone. And this is also available at the tract level, so you can kind of see it much more granularly. And what I zoomed into here is the San Antonio, Texas area. And so you can see on the left-hand side, we're looking at households with seniors living alone. So there are definitely some significant census tracts where you can see that over 13% of seniors in those areas are living alone. On the right-hand side, one of the other ACS layers that we have available are population living in group quarters. So in the assessment, we kind of lumped all those together, correctional facilities, nursing facilities, dormitories, military camps, those types of things are all considered group quarters. But we do have breakouts for each of those in the map room. And so that's what you're seeing here. Again, in the San Antonio area, we've got some pockets where we have large populations over 2%, it says here, and I know some of them are more around the 5 to 7% if you click on the map, that are living in nursing home or long-term care facilities. And so we're not just looking at seniors basically in their single family homes, but also those that are living in group homes as well. So both of those are available from the ACS and have been updated, and you can see those on the site. Something else to consider is seniors that don't have access to the internet. So something that COVID has really highlighted for all of us is the need for telehealth. And if you don't have the internet, then it's very hard for you to make it to your telehealth appointment a lot of times, right? And so another ACS available data layer is households with no or slow internet. Again, percent by tract, and we can see that as the most recent release here. There are some areas, again, of San Antonio where we can see that there are really high rates of people that have no or slow internet. Now, we can't say for sure that they're seniors living alone, but we can sort of make some inferences, right, where we see those pockets of seniors living alone and we see households with no or slow internet. Those are going to be the areas that there may be, again, some significant outreach that's needed to reach those folks, to make sure that they're getting and accessing the healthcare services that are available, and that they know what is available to them as well. A couple of other considerations when it comes to seniors. One of the things that we've heard about a lot too are high heat days. So, thinking about climate change and how it's affecting some of our areas, and some areas greater than others around the United States. That San Antonio area, obviously, it's probably pretty hot in Texas, and we can see that also represented not in ACS data, but again, some complementary data from the CDC and from national, I think it's a land or weather source there, that it tells us, the days with total high heat index above the 99th percentile. So we can see that there, that Bexar County, where San Antonio is, they have an average of 12 of those days, which is more than both the state and national average. Again, something to consider when we've got older folks living alone that may not be able to access different types of services. We can also see here that we're looking at different types of high heat index values and weather observations. And again, they observed a very high amount of high heat days in that Bexar County area, much more significant than the state of Texas and the rest of the United States. So again, just as we're thinking about how we can dive deeper into some of these data layers, and then also find complementary data to help us strengthen our understanding and maybe some policy decisions or program decisions that we make. There are lots of these indicators available. So I talked a little bit about heat-related deaths. They're definitely increasing across the nation. We worry about seniors making sure that they have access to fresh fruits and vegetables, just like we would any other vulnerable population. That access to broadband and telehealth services, again, is going to be very important. It became very important during the pandemic, and as more and more doctors are being available online, making sure that seniors can connect to those folks is also going to be important. And then last one, we heard a lot about loneliness, right? Which may or may not be sort of an epidemic in and of itself around the state. So shifting gears a little bit, we do have a tool that I don't know that you're all aware of, so I wanted to make sure to include it in the webinar today around what we call the vulnerable populations footprint. So I have mentioned and referenced vulnerable populations several times, and there is another way to sort of dive deeper through this footprint tool to look at where, again, potential populations that are more vulnerable are living within an area at the census tract level. So we have updated the VPF tool to the 2016 to 2020 data. So it is available. We did not make it, we don't have a retroactive version of this available like we do the assessment. So it has been updated. And what the vulnerable populations footprint does, by the way, this is a tool we've had for a long time. It looks at the intersection of poverty and educational attainment. So we know that those are two of the biggest factors that drive health outcomes, poverty and educational attainment. So what this tool does is it really looks at those two indicators individually. So where do we see the population below poverty level, 25%? or higher? And where do we see the population with less than a high school diploma at 25% or higher? So when an area or a census tract only meets one indicator criteria, let's say population below poverty level, you'll see that it's going to be indicated in orange. So these areas have high levels of poverty, but their population with less than a high school diploma is not over that or at or over that 25%. Where we see opposite to that, where we see just purple, it's showing where the population has less than a high school diploma, but they're not meeting the criteria for the population below poverty level. Now, where areas then red is where it meets both of those thresholds. And those are going to be, right, what we would consider the most vulnerable populations, most vulnerable areas and census tracts to be able to focus on. The tool itself allows you to modify these sliders. And we did that because we felt it was important to reflect the differences between rural and urban, right? We see much higher rates of poverty, typically in urban areas. And so you might want to adjust that threshold a little bit higher. And, you know, or if you want to maybe adjust it a little bit lower for some rural areas, you can do that as well. So the question that I ask, because sometimes we get this question, is where is the vulnerable populations footprint on SparkMap? So I'm going to take you to the site and show you here where it lives. So you don't have to be logged in to access it. You can be logged in to access it. But basically, you're going to go to the map room, and that's where the vulnerable populations footprint lives. The best way to get to it is to, when you fall into the map room, you're not going to search for any data or anything. Just go ahead and close this window. Under the tools, so you can click the tools button up here at the top left, or you can click the tools bar down here at the bottom of the legend, and you're going to scroll basically all the way down. And when you get down there, you're going to see that we actually have several footprint tools available. The very first one is that vulnerable populations footprint. We also have just a basic community demographic footprint that tells you a little bit about basically race and ethnicity, age, gender, those types of things. We do have a location opportunity footprint. It has a little bit dated data in it. It was part of like a White House release of some specific data. It's still pretty cool to look at. And then we have also created a COVID-19 vulnerability footprint that includes rates of uninsured, high population density, and populations over the age of 65. But I'm going to go ahead and just click that vulnerable populations footprint, and you're going to see now that it has loaded for the entire United States. And so this is how you would access it. And it is available in the map room because while we're already looking at two indicators, right, poverty and educational attainment, at any time you can add additional data to the VPF. So if we wanted to zoom into an area, I'm just going to pick somewhere here in Kentucky, it looks like, we can kind of see how that starts to play out, right? Some of those orange areas where we're only meeting the poverty threshold, some of the purple areas where we're meeting the educational attainment threshold, and then these red areas where it's meeting both. I should be able to click on the map and get that information and see that both of those thresholds are met, population in poverty and population less than high school. Both of them are over that 20 and 25%, which is our defaults there, and be able to get those actual numbers, which I always think is really important. So how far over 20%? How far over 25%? These are pretty significant. 37% is pretty high. So we can see some of that here. And then, like I said, at any time, we could add additional data. So we could look at things like housing cost burden, which we were looking at earlier. Let me see if I can find that. I should have made a better search probably. Oh, here we go. I can add that to the map here. I can pull my VPF layer on top of it. I can label my housing cost burden so I can see that as well. Change it to track so it aligns with what's available in the vulnerable populations footprint. And then I can also generate a quick report. And so this is going to tell me, the quick report's going to give me a nice little map and tell me about some of the demographics in the area. And it will include this additional indicator that I've added here to the map. So that's available to you. So wanted to make sure that you knew about the VPF and you knew where to find it. The other thing I was going to show you while we're here are those tiger boundaries. So as we mentioned at the beginning with the census boundaries, we have all of these different tiger boundaries here. You can look at the tiger track boundaries for 2020. That we also have those available for 2019. And if you add those both to the map, and you can, like I said, you can toggle between them or use the swipe layer that's available in the tools bar, you can be able to see where some of those changes are. We also have some really great examples of this in a recent blog post. So if you want more information or a little more instruction on that, check out the blog here on SparkMap. Finally, the last thing I did want to show as well is the note around the community assessment. So you'll see here at the very top, we have, if you'd like to create your assessment with old data from the ACS, you can visit this ACS 2019 assessment link, and it will populate with the 2015 to 2019 data instead of the 2016 to 2020 data. Now, one thing to note is all the other data in the report, if they've been updated, they'll be updated. We're just making a little bit of a special run for that older ACS data. So, but you can see then reflected in all of our indicators, the updates to the ACS data. Some of them we just went through. Not every category has ACS included in it, but a lot of them do. So with that, I'm going to go ahead and pause and see if you guys have any questions. If there's anything that you want me to demonstrate again, or yeah, just any comments at all. All right, well, hearing none, I will show you here my last slide. So if you do have any questions and or you have questions about, like I said, the census tract boundary changes, how that may or may not affect analysis that you've done currently or in the past, feel free to reach out to us. We have our email address down here at the bottom. So it's sparkmap@missouri.edu. We've got a team of help folks that can answer your questions. There's also the chat bot on SparkMap. You're welcome to chat us at any time. We usually are only there during Monday through Friday, 8 a.m. to 5 p.m. Central Time. So if you chat us on the weekend, we may not be able to get back to you till Monday. But for the most part, we'll try to get back to you as quickly as possible. I want to thank you all for joining us for our June webinar. And like I said, if you do have any questions or comments, I'll stick around here for another minute or two. Otherwise, I hope you guys all have a good rest of your day. And I hope to see you around SparkMap. So thanks so much.
Thank you.